Most of the people do not have a differentiation. Cardiac arrest और heart attack दो अलग अलग चीजें हैं.
Heart attacks, if not treated promptly or on time, can lead to cardiac arrest.
Siddharth Shukla, while doing the gym, he expired due to cardiac arrest. Even then, it was believed that he had a very healthy lifestyle, and even then he got expired. This mental health is the biggest problem जिसको हम ignore कर रहे हैं.
It can be simple anxiety, it can be simple sleeplessness, it can be simple sweating as well, it can be feeling low energy. This again is a depression. The most sought after branch is a psychiatrist and a psychologist.
अभी अगर मैं करंट नंबर ऑफ सुसाइड्स की बात करूँ विच इज़ इन अ ईयर 1,64,033. हमने एक फेमस केस भी देखा था बॉलीवुड में सुशांत सिंह राजपूत का, जिनका प्राइमा फेसी यही समझ में आया था कि ही वाज सफरिंग फ्रॉम बाइपोलर डिसऑर्डर.
So bipolar disease is not basically any particular disease, it's an advanced stage of depression.
Starting off from 8-year-old to 10-year-old, the porn addiction starts.
Sex education is missing. So even if we bring up the sex topic with anybody, it is perceived not appropriate.
Is it also related to increasing number of rapes in our country? चेंगे जो अभी रिसेंटली हमने एक बहुत ही दर्दनाक हादसा हमारे कंट्री में हुआ है कोलकाता में, एक हॉस्पिटल में एक डॉक्टर के साथ अभी जो केस हुआ है. सर दैट वाज रियली ब्रूटल एंड इनह्यूमेन वी कैन से. इसके पीछे सर कैसे हॉस्पिटल्स में भी अगर सेफ्टी नहीं है गर्ल्स के लिए तो फिर तो हम कहाँ पर एक्सपेक्ट करेंगे सेफ्टी.
5.2 million cases of medical negligence have been reported in a particular year. नमस्कार, मैं हूं एडवोकेट वरुण खट्टर और आज मेरे साथ मेरी को होस्ट हैं.
नमस्कार, मैं हूं साक्षी छाबरा खट्टर और हम आपका हमारे चैनल द सोसाइटी स्पीक्स में तहे दिल से स्वागत करते हैं.
आज हमारे शो पर भगवान आने वाले हैं,
लाइफ सेवियर आने वाले हैं,
वॉरियर आने वाले हैं.
ये वही लोग हैं जो बिना किसी स्वार्थ के 24 घंटे समाज की सेवा में लगे रहते हैं. कोई भी आपातकालीन स्थिति आए या महामारी की स्थिति ही क्यों ना हो, ये लोग बिना अपने जान की परवाह किए हुए, बिना अपने परिवार की परवाह किए हुए समाज के लिए हमेशा तत्पर रहते हैं.
कोविड-19 जैसी महामारी के समय जब पूरी दुनिया अपने घुटनों पर आ गई थी, तब समाज के ये वो वॉरियर्स थे जिन्होंने अपनी और अपने परिवार की चिंता किए बिना समाज के लिए 2400 घंटे काम किया है.
तो और कोई नहीं, हमारे आज के गेस्ट हैं अनसंग हीरोज ऑफ द सोसाइटी, डॉक्टर्स.
With this, I would like to welcome our first guest, Dr. Kausar Shah, who is the Executive Vice President and Zonal Head for Max Healthcare. And he is also the recipient of Dr. APJ Abdul Kalam Award. And mind you, he is a wonderful TEDx speaker as well. Welcome to the show, sir.
और हमारे दूसरे गेस्ट हैं डॉक्टर संजय जायसवाल, who is the head and director at Emergency Max Super Specialty Hospitals. He is also the vice president for Emergency Medicine India. He has been awarded with EM Leadership Award and currently he is one of the best ED doctor in our country. We welcome you, sir.
Thank you very much. Pleasure is all ours.
So let's start with the first topic for today. एंड सबसे पहले हम स्टार्ट करना चाहेंगे एक बहुत ही हार्ट ब्रेकिंग इशू जो हमारी कंट्री में अभी है, कार्डियक अरेस्ट, जिसके ऊपर अवेयरनेस लाना बहुत ही ज़रूरी हो चुका है. क्योंकि करंटली हमने देखा है रिसेंटली बहुत सारे ऐसे केसेस आ रहे हैं कार्डियक अरेस्ट के जिसके ऊपर अवेयरनेस नहीं है.
So the question is very simple. I would like to add one more point to this question. Are you guys talking about cardiac arrest or heart attack?
Sir, I mean that is also something कि we are
yeah.
confused about कि most of the people do not have a differentiation कि उनको पता ही नहीं है कि cardiac arrest और heart attack दो अलग अलग चीजें हैं.
So heart attack is like, like spectrum of syndrome. It can be mild chest pain to coronary heart artery which supplies the heart, the blockage of those arteries. Those are called as heart attacks. Heart attacks, if not treated promptly or on time, can lead to cardiac arrest.
Okay.
Because there is a lack of blood circulation to the main heart muscles and heart is deprived of oxygen and it gets into ventricular fibrillation rhythm and finally then happens a cardiac arrest.
तो ये कह सकते हैं कि मतलब हार्ट अटैक इज द इनिशियल स्टेज, मतलब पहले हार्ट अटैक एक स्टेज बनता है एंड देन इट लीड्स टू अ फाइनल सिचुएशन जहाँ पे एक कार्डियक अरेस्ट होता है एंड देयर इज अ लॉस ऑफ लाइफ.
Absolutely. So heart attack, the thing what you want to understand ki how to prevent or how to treat and what to do in such cases when a patient is getting heart attack or any symptoms which is suggestive of a heart attack, right? So first thing what you need to do that you need to understand the awareness, and if suppose you are somewhere near to hospital, you should immediately rush to a hospital and leave rest of the job to the hospital and the doctors to diagnose it, to treat it, and to thereon take care of yourself, of your heart and your well-being.
So there can be any first aid which can be given by the immediate relatives or family friends जो भी वहाँ पे available हैं, तो कोई first aid या CPR,
बिल्कुल
क्योंकि इंडिया में ये
इसके-
भी knowledge नहीं है अभी
हाँ
तक.
बिल्कुल CPR जो आपने बात की है ना,
जी.
so there are many initiatives in our country. The awareness regarding those things are very, very less. Like Each One Save One is a Society for Emergency Medicine India is doing. We are tagging the school, children, societies, and we are training them. Many organizations, many hospitals, they are going to each and every society, places, people, schools, and they are doing the basic life support training. And also the most important thing, like you said, कि किसी को हार्ट अटैक आ गया या कार्डियक अरेस्ट हो गया, तो what should the people do? So that is the most important thing. Every individual should be trained in bystander CPR.
Okay.
So bystander CPR is one thing which I think each and everyone should be trained in, which can save lives.
इनफैक्ट मैं एक छोटी सी चीज़ ऐड करना चाहूँगा. आफ्टर टुडेज डिस्कशन आप लोग थोड़ा सा दिखावा कर सकते हैं कि हमारे को मेडिकल नॉलेज अच्छी हो गई है. सो डोंट आस्क कार्डियक अरेस्ट है, मतलब हार्ट अटैक है या अरेस्ट है, क्या है. आप सीधा डॉक्टर को जाके पूछो MI तो नहीं है. MI is the medical term which we use.
Myocardial infarction.
Full form is myocardial infarction.
Okay.
So what Dr. Sanjay said is actually in medical terminology we refer as either short form में MI, full form में उसको myocardial infarction बोलते हैं. Which again is the same thing कि हार्ट के अंदर, हार्ट के मसल्स के अंदर ब्लड सप्लाई जो है वो कम हो जाती है. तो यू कैन जस्ट गो एंड शो योर एक्यूमेन कि देखो मेरे को पता है MI तो नहीं है.
MI तो नहीं है.
And even the people who are listening to this, they can also converse like this.
And one more thing, sir. I mean, that is something initially we used to hear. जो हार्ट अटैक्स होते थे या कार्डियक अरेस्ट होते थे, I mean, that was in a range of people of the age of 45 to 60 to 65 and so on. But nowadays, these cases are coming in wherein the heart attacks are coming in at the age of 15. I mean, what could be the possible reasons for it?
So if you look at the historical events of cardiac arrest or heart attack, it used to happen in elderly age group with some other comorbidities, right? But now, as you say, it is happening in younger age group. So the reason is very simple, our lifestyle, culture, food, oils, what we eat. The trans-saturated fats, what we eat in fast foods and all. These are the sedentary lifestyle, lack of exercise, stress, anxiety. So many things are there contributing to it. Earlier, what you used to see, 85% of the time, our ancestors, if you see, sir, what used to be? They used to be out in the field, in the ground. Now everything is controlled. See, even this room, air condition is controlled.
Yes.
Where we sit, where we work, forget working. Even the people, the youngsters who go to the gym, AC on hai ya nahi?
While traveling also we are in the car and ACs
Yes,
are on.
you go anywhere. You are not used to that extreme of difference of temperatures and all those
Yes.
things. So the metabolically, the syndromes are rising, metabolic syndromes are increasing, and this is leading to heart attacks.
I think another major reason which I believe what used to be in our times and what we see in the youngsters nowadays, there is a tremendous amount of competitive spirit, but not the healthy competitive spirit. It is unhealthy competitive spirit which is developing in people, which is about show off,
Exactly.
which is about peer pressure. For example, even if I am physically on exercise or gymming or whatever, I'll still be trying to do something ताकि मैं लोगों को दिखा पाऊँ. It's not for my own sake.
Yeah.
It is to show off. When you are into that mindset, you are indirectly getting into a stress mode also. And cardiac reasons हो चाहे कुछ भी reasons हो, the mental mindset and the mental strength, it has a huge amount of role to play. Now I am into, in fact, meditation as well for some time now, and I have realized that, and I am an aggressive person. I used to be pretty short-tempered till about a few years back, but I have become very calm in those many such circumstances now, and I see the difference in me in fact. So if I think this meditation part, which is our own country's thing given to the world, yoga and meditation,
Yes.
अगर हम अपने बच्चों में एक मे बी टीनेज टाइम से इसको इंट्रोड्यूस कर
Starting
पाएँ,
से,
आई थिंक हमारी नेक्स्ट or maybe next to next generations जो हैं, they will be far better in developing this control, which is through the mindset only. So I think that can be a huge thing. This is one of the major reasons, as Dr. Sanjay also said, which is creating the cardiac arrest in such young people as well, or heart ailments or such things in the young people as well.
And one more thing, I mean, if we talk about the lifestyle, I mean, there are people in Bollywood as well. In the recent way, I would say, there is a famous personality from Big Boss as well, like he's Siddharth Shukla. While doing the gym, I mean, he was maintaining a very healthy lifestyle. He expired due to cardiac arrest. He had a very healthy lifestyle. When we got a chance to, see the interviews of his family, even then it was believed that he had a very healthy lifestyle, and even then he got expired. And I have seen many people around while playing cricket. I mean, they are doing the physical activities and they are maintaining a good lifestyle while playing cricket, while being into the physical activities, doing gym, and even then it is happening. So what could be the possible reasons behind these?
So there are many reasons can be behind this. One can be the diet. I do not know whether they were vegetarian or non-vegetarian. So if you go into the vegetarian diets, in today's date, what has happened? The vegetarian foods, the vegans, whatever suits you, you can eat. Whatever you love, you can eat. But what is happening? It is all processed. The land and the soil distance has increased. A lot of pesticides, herbicides, insecticides are used. In every vegetables and fruits you will get to know. Until unless you grow it with your own hand, in your own field, you're not sure the source,
is it
how
organic
it
or
is,
not?
right?
Yeah.
So person gymming is okay. So then you do not know about his stress level, his anxiety, his mental well-being.
Yes.
So there are a lot of factors which contributes to these things. Just going to gym, running, cycling. Sometimes there can be pathological issues also in the heart. So there's so many contributing factors: stress, environment, and what you eat, how you eat. It is not only about having a good physique can prevent you from heart attack.
सो सर क्या आप कुछ ऐसा रिकमेंड कर सकते हैं, कोई मेडिसिन जो हर किसी को कैरी करना चाहिए अपने साथ, एक इमीडिएट
For cardiac arrest, you cannot do anything. The
Okay.
person sitting next to you should be trained in bystander CPR.
या
That is the one medication. And if you have a cardiac arrest, then only he can save you. The earlier the CPR begins, the better the chances of survival.
Okay.
In cases of heart attack, you have some time to reach hospital. You reach hospital. Meantime, if you can have some baby aspirin of 81 milligram, if you have somewhere in your pocket, just take that. Nothing else.
I mean, aspirin can be one of a thing. I mean, that can be a savior in a tough time, I would say,
That's
Yeah.
true.
of a mild dose.
I would like to take one step backwards as the question that you ask, carrying some medication or what can be done when the event is happening. We as Indians are not taught about the value of preventive health checks.
Oh, yes.
Yes.
Now, preventive health checks is a very important thing, which is to understand what is lying behind the otherwise healthy looking body.
Yes.
So, which is very important because we don't know what is happening inside our bodies till the time we are diagnosed or till the time the body throws some symptoms. So, timely preventive health checks, they actually help you to understand what part of your body is leading into what direction, which may lead into something else like cardiac arrest or maybe a brain stroke also in over a period of time. Because body internally will constantly be changing towards it.
तो सर
But
ये
we
कौन
don't-
से symptoms होते हैं, मतलब
Signs and symptoms.
like what are the signs and symptoms? Because this show is all about awareness. I mean, वो कौन से symptoms होते हैं कि जिनसे पता लगता है कि now boss there is something body is not responding.
और मुझे चेकअप के लिए जाना चाहिए.
Exactly. वो क्या symptoms होते हैं?
So इसमें बहुत सारी चीज़ें हैं but some common things for which the person must go. In fact ये जो मैं preventive health check की बात कर रहा हूँ, it doesn't require any symptoms. It should be a healthy person deciding today, yeah, I want to go and see what is inside my body. That is real preventive health check. But still, if you want to talk about the symptoms where the person must definitely go towards consulting a doctor, for example, breathlessness. आपको अगर breathlessness होने लगती है थोड़ा एक्टिविटी के बाद ही, you must go and consult. It could be something as simple as lung thing, and it could also be something as cardiac. I mean, breathlessness is one of the commonest thing, in fact, which the body gives to you. It could be just stamina, but at least आपका doubt mind से निकल
क्लियर
जाएगा.
हो जाएगा. Yes.
And I think this is one of the commonest things which we must go to consult a hospital. कि why is this happening? Because cardiac can be the reason, lungs can be the reason, basic stamina can be the reason. It can be any of these three things. But breathlessness is a very, very simple yet not really understood by people that this should be seen through. That is one thing. Second again is like when you talk about the like brain part or so, constantly headache or this type of a thing, again we must go and consult to the right doctor. Because headache again could be for as simple as some stress, maybe the eye reason, or maybe it could be something about the brain. So again, the common symptoms only which the body gives, we must not take it for granted. Somebody not getting sleep. एक दिन नहीं आई कोई बात नहीं, आप continuously if you are not able to sleep properly, 100% you need to consult the doctor. Don't keep on popping the sleeping pills because that is not going to help you. You must consult the doctor because why is this happening? Every time we must know why, where is the reason? For every symptom, I mean, we are taught as doctors, symptoms can have 5, 6, 7, 8, 9, 15 causes behind it.
Okay.
That's why we are taught you must evaluate the symptom to the last level so that you understand where is this originating from. So that's why it's extremely important to understand these common symptoms. Don't take them for granted. Even, I mean, if our finger is moving like this, which is a very small thing, we may think, yaar, ye kya hai? Ho jayega theek. Don't take it lightly. You don't know, it may be a stroke. You don't know, it may be epilepsy. Because these are again very small
like just
things.
a normal movement,
Absolutely.
we cannot avoid
Absolutely.
normal movement
No,
as well.
you
We
should
don't
not.
take it seriously actually.
You should
But
not.
usually in India, in our country, people take
That's
it
what I'm
very
saying.
casually and we
Exactly.
tend to ignore such symptoms. Like, it's
So
okay,
basically,
yaar, ye to
sir,
chalta hai,
anything
second
of acute onset, like
Yeah.
which you never had before, and all of a sudden onset is there, like any kind of chest discomfort, like I said, shortness of breath, or sweating, or palpitation, or upper abdominal pain, you should first rush to the hospital and get yourself evaluated.
Even as he just said, the abdominal pain. I mean, many times the MI has
Heartburn.
happened to the patient,
Yeah.
which has we sort about the cardiac arrest. But the MI at times is presenting purely as a gastric pain. And this
Okay.
happens. It is a very common thing. And the patient keeps thinking, yaar, gastric hai,
Gastric.
khana maine
Gastric,
oily
yeah.
kha liya tha. He'll keep on popping
I
something
mean,
which
even
is...
our parents, if you look at them, I mean, they are almost touching their 70s. So it's like, yeah, just a gastric thing. Gas ban raha hai, kuch nahi hai, sab
No,
theek ho
no,
raha hai.
it should be
This is a
consulted.
common
It should
thing
be
which
Common
happens.
thing
Ho
in, at
gaya.
least in
No.
our country.
Yeah.
It should be consulted because some medicine that you will take will give you immediate relief. But that is not going to cure the cause.
Okay. एंड विद दिस मैं अपने व्यूअर्स को आज एक बहुत इंपॉर्टेंट मैसेज देता हूँ कि प्रिवेंटिव हेल्थ चेकअप इज़ रियली इंपॉर्टेंट. कोई ऐसा नया सिम्टम जो आपकी बॉडी के अंदर आता है, प्लीज़ उसको सीरियसली लीजिए. इट इज़ नॉट समथिंग कि ऑल ऑफ अ सडन कोई चीज़ नहीं होती है, उसके पीछे कुछ ना कुछ रीज़न होगा. एंड प्लीज़ स्पेंड सम मनी ऑन योर सेल्फ, एंड दीज प्रिवेंटिव हेल्थ चेकअप्स आर रियली इंपॉर्टेंट. प्लीज़ टेक देम सीरियसली. सर, कमिंग ऑन टू द नेक्स्ट थिंग, आई मीन दिस इज़ अ टॉपिक हमारे यूथ इसके बारे में बहुत कुछ जानना चाहता है. सर, दैट इज़ द मेंटल हेल्थ. दिस मेंटल हेल्थ इज़ द बिगेस्ट प्रॉब्लम जिसको हम इग्नोर कर रहे हैं बिकॉज इट्स नॉट विजिबल एट ऑल. तो सर, आई रियली वॉन्ट टू अंडरस्टैंड कि हाउ कैन वी टेक केयर ऑफ आर दिस मेंटल हेल्थ, एंड मोस्ट इंपॉर्टेंटली आई विल टॉक अबाउट डिप्रेशन.
See, mental health is something which is grossly misunderstood by most of us.
ओके.
We always perceive that one छोटा सा confusion होना, थोड़ा सा low feel करना, थोड़ा सा low energy feel करना is all normal. But if it is happening constantly, you're leading into a depression. So depression is what? Depression is nothing. It can be anything or everything happening to you. It can be simple anxiety. It can be simple sleeplessness. It can be simple sweating as well over a specific thing. It can be feeling low energy for something. It can be आपका मन नहीं लग रहा किसी काम करने में. This again is a depression. But something like this which is getting constantly repeated, it is a form of depression. If you ignore this over a certain time, it will lead into the bigger and bigger type of a depression. So I think that is one thing again which we all need to understand, that mind related things as well, these are the signs which we must take care of properly. And it is not to be taken lightly. I mean, don't consult just a friend कि भाई ऐसा हो रहा है, उसने बोल दिया कुछ नहीं, ये कर दे, वो कर दे, दिमाग इधर घुमा दे, यहाँ से माइंड हटा ले. It's all going to give only temporary relief to you for a specific time only. But again, if you want something to be really looked into at a deeper scale, you must go to a psychiatrist. But the problem in our country is we are very, very concerned before going to a psychiatrist because we believe
There's a social
Stigma.
It's a
stigma.
taboo.
Yes,
Stigma is
there's a social
we believe it's a
stigma.
taboo, it's a stigma.
taboo.
पागल खाने पागल को डॉक्टर को दिखा रहा है क्या कर रहे हो तुम?
Exactly,
पागल हो गया
exactly.
क्या? But I'm telling you, there is a great shift of late in our country also. So I mean, there are so many good psychiatrists who are my friends. They say about this in the last about 5-7 years, a lot of normal looking people are also coming for normal things to consult with them, which is a very healthy thing, which is a very happy thing. Yet we are far behind compared to a country like US or so. You know, in US, the most sought after branch is a psychiatrist and a psychologist.
सर डिफरेंस क्या होता है साइकियाट्रिस्ट और साइकोलॉजिस्ट
हमारी कंट्री में तब तक ये भी
if
क्लियर
I
नहीं है
talk
कि
about
वो
even, I
साइकोलॉजिस्ट
would
है.
not be in a position to answer that question कि साइकियाट्रिस्ट और साइकोलॉजिस्ट में डिफरेंस क्या
difference?
So I'll tell you a very basic difference. Psychologist is not a trained medical doctor.
है ओके
Psychiatrist is a trained medical doctor. Now, in their approach, a psychologist will tell you about the therapies which are maybe your stress relieving or this and that, but they will not prescribe any medication to you.
Yeah, they will just tell
Yeah.
you talk therapy and behavioral aspect
Behavioral
of.
aspect and all
That's
those type
it.
of things. But a psychiatrist will also tell you about the medication part which are required.
So he can prescribe proper medication.
Yes.
Yeah, one is a doctoral degree and the other is a post-graduation degree.
He is more of like a counselor or
Yes.
Right. Sir, is depression a disease? I mean, if I would talk to my father, or if anyone of my age would, ask to his father, and I can challenge it. If I ask my father today, Dad, I'm suffering from depression, and he'll be like, coming up from a Punjabi family, and he'll be like, क्या होता है कुछ नहीं होता ये सब कुछ
Doesn't
नहीं
even
होता
exist
कुछ
for
नहीं होता
them.
जा खा पी घूम फिर क्या सब ठीक हो जाएगा. Is it a disease?
So depression is not a disease to start with. But if you ignore it, it can become a disease.
Non-curable.
And then it can be non-curable also because it doesn't have any specific medication. It's like an attempt which everybody makes to cure a depression beyond a certain level if it reached. But that is the time when it becomes really difficult to cure it. In fact, this is the time of depression when it is not in anybody's control, where the person can be harmful for himself as well or herself as well, and even for others. So that's the scenario which becomes a diseased scenario. Otherwise, it's not a disease; it's a symptom. I mean, it's a normal symptom which happens in many people. But the point is, we need to again go to the bottom of it, cure it from that particular perspective. Why is that so? Why is that so?
So, Kapil, one point I just want to add into it. So, depression happens once anxiety happens. Why anxiety happens? Because there are certain nutrients deficiency in our body, which gets converted into catecholamines, which are the neurotransmitters in our brain. So, neurotransmitter does what? It does your fight and flight response.
Okay.
So any person who is in anxiety or in depression, ask them 3 basic simple questions. Have you ever had this kind of episodes before, like you were having some anxiety?
Yeah.
So the answer would be most of the time yes. You will say yes. So if I ask you, is there any specific trigger which leads you to anxiety? What would be your answer? Yes or no?
Yes, I believe.
Specific triggers.
Yes.
Like, even we are podcasting right now.
Yes.
So many mics, lights, cameras are there. This can trigger her anxiety. If I ask another third question.
When I'm like put on the spot,
Yeah.
so I get that anxiety.
Correct. So now if I ask you another third question, does medication, tranquilizers, sedatives help you? No. Means there's nothing inside, everything is coming from outside.
Yeah.
How we perceive that means to get fear, you really need not to have fear in reality.
Okay.
So that leads to anxiety. And anxiety,
Leads to.
the level, when it goes up, it is converted into depression or maybe some kind of other psychiatric illnesses it can lead to. So basically, it is the nutrients and the catecholamines, lack of dopamine in our brain, neurotransmitters in the brain, which can cause all these things. And why these things happen? It again goes back to our nutrition, sir.
Yeah.
That what you eat, how you eat, and more of the carbohydrates people are eating. So that you have to bring down, cut down in your diet. You need to have more of the essential amino acid fats, saturated fats. Because all your neurons, hormones, cells, myelin sheath is made up of cholesterol. And people are scared of taking cholesterol. मेरा तो cholesterol high हो गया. होना
घी
तो
नहीं
ना.
खाना.
That is important because there are a lot of fat soluble vitamins. How it will get absorbed in your body if you are lacking in fat. So basically my philosophy is that we need to have like 70% of the diet as fat, 20% as the protein, maybe 5-7% as carbohydrates will do, because your body makes only one thing, liver it makes only one thing, that is carbohydrate. You must have heard about essential amino acids, but have you ever heard about essential carbohydrates? Never. So
No.
we need to, the message should be clear to the audience. They need to cut down on the carbohydrates because this leads to brain fogging. Any hypoxic condition will lead to other unwanted diseases in your body.
In fact, in addition to what Dr. Sun just said about the diet part, other than the food diet, we also need to be mindful about our mental diet that we are getting,
Yes.
Yes.
what we are reading, what we are watching on the TV, what we are
Yes.
watching or reading on the messages,
Your
or
company.
on the, your company, the people who you're talking to, and the mobiles that we are using, or the messages, or the whatever we are seeing on the Googles and all. It has a huge amount of impact. I'll give an example of the COVID times. So I was heading one of the hospitals at the time, not in my present scenario. So we were in the middle of the COVID times. I mean, we all know what happened that time. Now, every single day, I used to be going back so depressed, in the sense that I was not able to see the way things were happening
Because
that time.
that is what you were seeing.
Yeah,
dead bodies
I mean,
around.
day in, day
people.
out and all. And then I would go home. Out of curiosity, I would switch on the TV. Again, I would see the same thing.
Yeah.
So many people died there. So many people died there. This family is suffering like this and all that. And again, I used to be in a I practically stopped talking to people at home. Then I realized, yeah, something is wrong. And because I always believe in mind power a lot, I practice this a lot. I said, something is going wrong in me. I mean, this is not the way I am.
This is not
I am not the one who can be scared or fearful of anything. I did just one small thing. I stopped watching TV. I stopped reading any messages or the news coming about any number of deaths anywhere in the world because of the COVID. And within 2 or 3 days' time, I saw a complete shift in my mental strength, which was required, in fact. I had to lead the entire
Sir,
show.
One more thing, this reminds me of, I mean, this social media, I believe, is one of a major cause of this entire depression kind of a thing. Because I'll give you an example. We are so much involved in our social media, right? We have almost cut ourselves with the physical presence of the nature, right? And this causes, at a later stage, we get to know that we are lonely. I don't have friends in my life. So do you think that loneliness also plays a very vital part in this depression kind of a thing?
Hugely. And you actually touched upon a very important topic,
Important, yeah.
social media, which I really, really love to talk about when I talk about it at various places. Social media is something, I'm not against it, but we need to be mindful on how to use this. Now, how does the depression or these things happen through the social media? We live it, I would say, a different life on social media, and in reality, it is different. I may be writing on the social media that I'm so good on this. In reality, I may not be. So I'm creating a specific image of myself which I know is not real. That itself is a stress. That is one part. Now, second stress which is going to come through this is, after I put something on the social media, I'll see how many thumbs up came.
Exactly.
Like-
Our life is all about the
Like,
likes.
Who all have
Yeah,
commented
we are
on my
posting
post.
for likes
So
only.
instead of generating friends in my routine life, I'm looking at those first. I may not be friendly with him then if he has not put any thumbs up on my post. I would not like him if he has not put any comment on me on my specific post. But I would be happy with somebody who I don't even know maybe. Maybe somebody sitting in some other part of the world. If the person has put up a thumbs up or so, putting a good comment on me, I would be feeling happy about it. But is that person real? Is that person really going to be standing with you if you ever require? It's a false life which actually
we are
we are
not
living on the
living in
social media.
reality. We are-
Absolutely. We show ourselves so happy on social media and all that. We show the parties of that we are doing on the social media and all that. But is that actually giving us the happiness? Is that real?
And one more thing, see, I have seen couple, right? Those who are, having their vacations at Europe, Goa, everywhere. And in the real life, I've seen they are really disturbed in their personal relationships. So I think social
So
media is
both the
actually
things
making
happen.
us fool, and
No,
we are
both the
the
things
slave
happen.
of the social media. I would
Both
say.
the things, as what you said, which is absolutely to the point. Another thing happens because of this. The people who
Watch
may
this.
be on an average side of happiness as a couple, when they see somebody on the social media looking so lovingly with each other, they feel like, okay, they are like that.
They
How
are
can I am
really-
not like that? And the division starts.
Neither. And also, I was you're taking the round of the studio. You can create all those images here in the studio also.
Absolutely,
That
absolutely.
you can go,
It
you're in
happens, it
Switzerland.
happens.
So I think social media has a huge lot to do with the mental health of our people, not only our country but the entire world, in fact.
So basically, any advancement in this today's world has positive sides and negative sides both.
Absolutely.
Yes.
It depends
Absolutely.
every
How you
time
use
on
it.
the individual
Yeah.
that what you want to take out of it.
Right. And in my previous podcast as well, I am not much in favor of social media, to be very honest. I won't lie, and I have been criticizing social media up to an extent now.
So you know what, I have a Facebook account, I have an Instagram account, I have this
Twitter,
X account,
LinkedIn.
I have LinkedIn account. But off late, I have restricted myself only to LinkedIn because LinkedIn I find a little professional,
Yeah.
and I really I don't recall when I visited the Facebook last, must be 7-8 months back, and I feel peace about it because I was feeling constantly something is artificial about it. I mean, many people do say that you need to increase your popularity through social media and through Facebook and all that. That's okay. I mean, I'm over it now. And on LinkedIn also, because I love to share my professional journey with people. Maybe it helps somebody. After putting the post, I was stopped seeing it. How many people are putting a thumbs up? How many views are there? How many people have put up a comment? Because that I realized was again putting up a stress. After putting a post, if I'm constantly seeing this for the next 2 hours or 2 days or 3 days, यार मेरा इतने लोगों ने
It
देखा,
creates
इतने लोगों ने
stress.
अच्छा इतने लोगों ने देख लिया मेरा, it's not something which can drive me. I have to drive it. If that is
Yeah.
giving me happiness, that means that my happiness is not in my hands. If that is giving me sadness, that is my sadness is in their hands, which is not the right thing. You need to have your own control.
And it becomes a vicious cycle. So the more you time, again after some time you will check. Somebody has
Exactly.
the likes has increased or not.
Exactly.
Yes.
And you have some people in your mind that that person has liked or not. Let me
Yeah.
see. What?
So with this, I would also like to discuss the another alarming concern, which is suicides happening in young ages as well.
Right.
और अभी अगर मैं करंट नंबर ऑफ सुसाइड्स की बात करूँ विच इज़ इन अ ईयर 1,64,033 which is a very high
These are
number.
the reported numbers.
Yeah.
Many are not reported.
Many even are not reported. So sir, इसका सुसाइड्स का भी कनेक्शन इसी से ही है कि डिप्रेशन हैपनिंग ड्यू टू सोशल मीडिया एंड पीयर प्रेशर.
Exactly.
Absolutely right. So again, two things have happened. If you see our country's suicide rate increasing from maybe around 40,000-50,000 in a year to what you're saying right now. One, as Dr. Sanjay said, it's not. Maybe this is not. This is just the reported number.
Yeah.
Actual may be different. Same we can attribute in the past also the reported suicides may be on the lesser side. Still, if you see the graph is only going up.
Yeah.
Reason is again the same thing. One, there is a tremendous amount of personal competition with each other, because of which you are getting depressed, and the friendships of the people that you are generating are not real. There is so much artificialism about this. It is on social media, so you don't get a person to talk to. If I am, for example, depressed, if he is my friend, I would be talking to him. But today, that friendship is lost. We are not in that particular arena of today where we have a very, very good personal friend with us. So, which is again, and the families have got divided. I mean, families do not have
Exactly.
time for each other. They would be sitting in the same room. She would be on a social media. You would be on a social media
I
at
mean,
your own
that is
account.
a true incident, I would say. I was out with my friends last week, and you won't believe we were like 4 friends sitting in a room, and we all were on our phones. I mean, we met after a long time, and we had a lot of things to discuss. All those funny moments, leg pulling moments have really lost their
Absolutely.
essence these days.
Absolutely. We are only putting on the messages to crack joke also, which is again not the real thing. So we are missing on that. So a lot of de-stressing which used to happen by talking to each other, like people talking at the dining table as well, which again has gone lost, because at the dining table also most of the time we are on the mobiles.
Yeah.
So I made it a mandate that my dining table, when we are having a dinner or so, nobody would be having the mobile in their hands. we'll talk to each other. Even if you don't talk much, at least you're creating a very good connect with each other. So those things are something which are constantly getting missed, and that is where the stress is coming through, that where to go through the stress.
And
I mean,
this
how
is
to
what,
de-stress
yeah,
yourself.
yeah. And this is what psychiatrists and psychologists do. When you seek their help, they will do talk therapy. They will change your behavioral aspect.
Yeah.
All those things. So then you realize and change yourself before you get into depression and all those psychiatric disorders.
So I'm also a life coach. So in life coach also, what the training I got is all about hearing a person, which is like a psychologist actually. Somebody who comes with a problem to you, you are not going to do anything about the problem as such, but you just have to listen to the person first. It is like a vomit in medical science that we say. If you have ever been through this feeling, until and unless you don't vomit it out, you feel something is stuck here. So the same
That
thing we need to give to the
heaviness,
person.
yeah.
The person has to speak it out first. You don't just. I mean, आपको बीच में उसमें बिल्कुल बोलना नहीं है.
हम लोग भी सर इसको ऐसे ही बोलते हैं, vocal diarrhea.
Yeah, absolutely. So you don't need to interfere in between. Let the person speak out. आप सिर्फ हाँ, keep paying attention that you are listening to the person, but just let the person be out first. The moment will come after 10 or 15 minutes when the person will stop talking. मतलब उसका सब कुछ निकल चुका है. That's where you need to start talking to the person. And when you talk to the person, again, solution has to come from the person. You are not supposed to give a solution to the person.
Okay.
You have to
Absolutely.
talk in a way where the person will say, अच्छा मैं ऐसा कर सकता हूँ, मैं सोच रहा हूँ मैं ऐसा करूँगा, शायद ये हो सकता है. You say, okay, try it. So you actually have to get the solution also out of the same person who is giving that problem in front of you. That is the difference
And
between.
that might give that person a courage that, okay, if I have a problem, solution is with me.
Absolutely.
Yeah,
So
and,
this
next
is
time,
within.
and next time he will try
Absolutely.
to look into himself.
That is one thing.
Exactly.
Second thing, the person will also have more acceptance of the solution which you are asking कि चलो इसको आप इसी तरह से करो, 6 दिन बाद दोबारा बात करते हैं इस पे. So the acceptance of carrying on that particular solution will be much higher because I said that.
Right.
If you tell me to do something, I may not be 100% into it.
Right.
So that again is a very big thing which I realized through the specific journey as a life coach.
One. Next.
And also there is a thing called bipolar disorder. इसका भी अवेयरनेस अभी हमारी कंट्री में ज़्यादा नहीं है और रिसेंटली हमने एक फेमस केस भी देखा था बॉलीवुड में सुशांत सिंह राजपूत का, जिनका प्राइमा फेसी यही समझ में आया था कि ही वाज सफरिंग फ्रॉम बाइपोलर डिसऑर्डर, जिसकी वजह से उन्होंने सुसाइड कमिट किया. तो सर ये बाइपोलर डिसऑर्डर क्या होता है? इज इट रिलेटेड टू दिस थिंग ओनली?
I mean, this is one of a trending word, I would say, these days. I mean, it has come into our attention because of the Bollywood thing, Sushant Singh Rajput, Honey Singh case. I mean, they talk about very frequently on social media that, okay, I had a bipolar disease and that is how my life was disturbed. But now I have come out of it and see, I have gained, again, that particular journey which he had earlier and he's back on the track now with his full potential. So what is this bipolar?
So he keeps encountering many such patients.
Yeah, bipolar is nothing. I'll tell you again. It again gets back to your neurotransmitters and chemical locha bolte nahi brain mein.
Okay.
So what essentially the catecholamines and dopamine and the essential neurotransmitters, the lack of these neurotransmitters causes this kind of depression. So bipolar is again an advanced stage of depression
Okay.
where people sometimes can be very sad, sometimes can be, in some exaggerated mood. So bipolar means what? It suggests that there are two poles of the disease. So bipolar disease is not basically any particular disease, it's an advanced stage of depression.
So usually लोगों को पता भी नहीं होता कि they are suffering with it.
Because there is some chemical neurotransmitters not present in their brains. Na? That is what is. So lack of dopamine. What is dopamine? See, even if you have a pet in your house, why do you have a pet in your house? Sir has Thunder. Thunder. The name of his pet is Thunder. So whenever he gets home and he pampers Thunder, what happens? What he's doing that time? He's releasing dopamine in his brain.
Okay.
Okay.
And dopamine is a happy hormone.
Happy
Okay.
hormone.
Happy
Yes.
hormone.
Yeah. So if you do something good which makes you feel good, you will not be depressed.
So can it be said that doing this podcast thing is a kind of a dopamine?
Exactly,
it
for
brings
you.
in me and it gives
Yes,
me
of
a
course.
happiness to do it.
You
Of
just
course.
see your, अभी आपके रोंगटे खड़े हो रहे होंगे.
Exactly. I mean, I
Yeah,
really
I can
feel
tell
very
you, na.
good about it.
Of
Yeah.
course, it is that only.
Okay.
So getting out of the stressful environment. So anxiety comes, then depression comes, then further depression adds, then you get into this is called as bipolar. Bipolar is nothing else other than the lack of much more required, neurotransmitters in your brain. That's it.
तो डिप्रेशन से ना मेरे को सर एक सॉन्ग याद आता है, तुम इतना क्यों मुस्कुरा रहे हो, क्या गम है जिसको छुपा रहे हो. आई मीन डिप्रेशन भी काइंड ऑफ ऐसा ही हो सकता है.
Exactly.
All right.
I think the cardiac arrest, when you were asking about the cardiac arrest situation in, post COVID era has increased, I think.
Yes.
That is also important point to understand ki it has nothing to do with COVID, because in youngsters, when it was happening before the COVID era also, and during this COVID, I think the first round of the COVID epidemic, the children were all safe. They were not vaccinated also.
Yeah.
हाँ, in
So
first.
COVID vaccine and cardiac arrest का कोई ऐसा relation नहीं है. This
It's
point
not
I
proven.
wanted to.
It's just a hearsay.
Yeah.
It's not proven clinically anyway.
I mean, because it's just a hearsay, but however, I mean, the media have still run that particular fact in the society that these COVID vaccine did not have proper trials, and eventually it is causing the
I
thickness of
think
the
I was
blood.
the first.
And
I was the first one to get vaccinated, sir.
Yeah.
And I'm all hail hearty and fine.
Yeah, that's what I'm saying. I mean, I think again these are not scientifically proven. These are just hearsays. There is no research on this so far. It's just an assumption actually.
assumption.
Sir, having said that, cardiac arrest mental stress से भी related हो सकता है, because there is a data that risk of cardiac arrest is higher in men
So
than
mental
women.
stress, again, the same thing goes on. Stress,
Yeah.
anxiety, depression, and all those things can lead to your heart attacks.
Okay, so sir, जैसे men में थोड़ा सा ज़्यादा इसके chances रहते हैं कि men usually tend to suppress their emotions, तो वो उनके अंदर ही
Because I
stress.
believe females are more stronger that way.
Yeah.
I mean, we can put
Of course,
it either
yeah.
way. Either way.
So-
Yeah.
Because there is a data which says that men are more prone to heart attacks, and they're 10 times more prone to heart attacks as compared to the women.
Yeah, I mean, we do have that egoistic issue with us that we should not share our things
Sure.
with everybody or anybody that matters.
Like मर्द को दर्द नहीं होता.
हाँ,
kind of.
वही वाली बात है. I mean, एक वो
Exactly.
ऐसा बना दिया हुआ है हम लोगों ने कि मर्द अगर बता रहा है दर्द हो रहा है तो यार वो मर्द नहीं है. This is nonsense. It's all human being. We are normal people. We have to accept it if it is happening. But we are in a denial mode most of the time, because what will other think, that drives us,
Right.
which is incorrect.
Okay. And then now coming on to our next question, which is a sexual health question. More of a sexual health. I really want to, discuss about very important topic, which is porn addiction. To be honest, I have seen a lot of people around of young age, starting off from 8-year-old to 10-year-old, the porn addiction starts. And at a later stage, it becomes such an addiction that a person cannot even come out of it. Their personal life, their married life, their professional life, all three are getting disturbed because of this porn addiction. What would you like to say about this thing?
I would say that we have a lot to do with our culture, specific in our country. If you see, we don't talk about the sex openly. Sex education is missing. So even if we bring up the sex topic with anybody, it is perceived not appropriate. Where families do not discuss about this, the kids are not aware about this. The kids that they gather any knowledge about sex or any such thing is only through the social media or through the peers. Now the peers, as we see, have been decreasing constantly. We are more and more going online and Googling and all that type. So there, the same thing happens. If they have direct access to the porn, they just fall for it, because that is something which excites them. I mean, that immediate body reaction happens, which they like then. And that,
Is it also a dopamine?
absolutely right. Absolutely. So it's again leading to a specific contentment plus excitement in them, which they become more and more like, and they can do this at their own time whenever they want to, in a hidden corner as well. So that gives them that freedom as well. Okay, I can do this at any point of time. I can see this at any point of time. So that is something which becomes very easily accessible to them, which actually it has become, and that's why they become constantly addicted to this. And addiction also leads to, as you said, about the relationships or the problems in the life subsequently, because their assumption about the relationship and the sex part of it is purely from that specific porn or so, which is not the reality. Now we all know even porn industry also is not the real industry. There is a lot of hypocritism which happens there. I mean, there is a lot of, and they're pure actors actually.
Exactly.
So they are acting into it. But we relate our personal relationship also to that. We start comparing to that. It is not true. It does not happen this way. We need to accept the reality in a different way altogether, which again doesn't happen. And because it doesn't happen, you again start going back to the porn. And because you go back to the porn, you again are dissatisfied with your partner or in your relationship. This becomes a constant cycle actually. So this again creates more and more unhappiness and discontentment with
I mean,
each.
as we already discussed earlier, like, people tend to compare their relationship with the porn kind of a thing. Right? And which I believe the other side is really unnatural or could be artificial.
It is.
Right? Or the acting kind of a thing. Like you
Yes,
said. And
it
people
is.
start comparing themselves with
Absolutely,
them. And
absolutely.
that really tarnishes the relationship actually. I would
Yes,
say.
yes.
So just to add to your point, you said like even youngsters, children, they are getting addicted to all those things. And as Sir said, na, like cultural things. So if you go back to our own culture, how we have been grown up in a joint family, big family, a lot of cousins, these things, that thing. So now the country is, every family is becoming a nuclear family now.
Yeah.
Everybody is busy in their own life. What do the children do? There's easily accessible online explicit contents, which you have a very free access. Anybody can have any access anywhere. So all these things, then cultural, then social, then environmental, then where the company they are getting into. So many things or factors are there to influence the children's or anybody for that matter. So that is why it is increasing in numbers. That's it.
So is it also related to increasing number of rapes in our country, the porn addiction?
We can actually attribute this because again,
No, sir, but I think rape and these things will fall apart because
Sir, I'll relate this topic. I'll relate this topic and how these topics are totally connected to each other. A boy wakes up in the morning, first thing he checks is social media most of the time. What he sees is nudity. In afternoon, he checks his mobile, what he sees is nudity. Be it any website, be it on any social media. He sleeps at night, what he sees is nudity. And that is what, a person only have one thing in his mind. Sex, nudity. Sex, nudity. These are the only things that is running in his mind.
And then there is lack of sex education as well, awareness
Yeah.
as well.
Yeah.
exactly, that's my point. It is not about the, like porns and all. It is about the environment. It is about the company. It is about the upbringing. It is about the in which environment it is the children are growing. So that all leads to all those kind of
And
things.
sir, one thing here, it's like when a person, that is what we discussed. Whatever we see around, right, we become that way. So it's like if we see a lot of nudity, most of the time, 99% of the time, if I'm seeing the nudity, be it any platform, a person would always have that thing in his mind. That, okay, I want this thing now. And when that thing is not easily accessible to him, that natural thing is not easily accessible to him, he has only seen these things on his mobile phones. In the hunger or in the eagerness to get that thing, in reality, he takes a chance and he does that heinous crime. That is what something, this is a new topic that I would think no one would have ever touched, but I think that could be one of the possible reasons.
and in fact, I would second with this what you are saying. How I link it, people who are addicted to porn beyond the level of, let's say, the teenagers or the small kids, but even after becoming adult, the people who remain addicted to the porn are the people who are low on self-esteem.
Yes.
They do not have any good relationship with them, so they basically have no partner as such. Such a person will still have instinct,
Yes.
will still have that specific requirement. So when the person is constantly seeing the porn, that requirement is only getting over and over and over filled. Now there is no outlet for the person.
Exactly.
And the person, as you were saying, the person starts looking at the other, it may be male to female, female to male, at the other sex as just an object. That this is what I
want to get.
want, but I don't have
Exactly.
anybody with me right now. Now, in such a scenario, if a person gets a chance to be alone or in a specific corner or at a lonely place with the opposite sex, there is a chance that the person will chance upon, as you are saying,
He'll play his cards.
will
because
play his
he
cards,
has that
and
thing.
specifically if there is something like something else also influencing like alcohol or a drug or so, then all the more
Yeah.
chance this will happen.
So it's not only a lone factor.
Yeah.
There has to be some other factors contributing to that
Like he's
thing.
No, of course, it's not
Intoxicated.
alone. Like
Yeah.
it has to be like person having no relationship, plus some addiction or something else happening, maybe some alcohol or something like that, and then the opportunity
Yes.
is also there where the person is alone with someone. That is the time when
So
they may actually get into
factors
this.
has to be there.
Exactly, exactly.
For that thing to become, to go to that extent that where the rape and all those things are
सर
happening.
इसका एक रीज़न ये भी है कि जो अभी तक हमारी कंट्री में टैबू है सेक्स के ऊपर बात करने के लिए, तो वो भी एक रीज़न हो सकता है कि किसी के पास कोई है ही नहीं जिससे वो डिस्कस कर सके कि वो क्या फील कर रहा है,
That's true.
उसकी क्या फीलिंग्स हैं, उसकी क्या रिक्वायरमेंट्स हैं. हमारी सोसाइटी में एक टैबू है कि हम अपनी रिक्वायरमेंट्स भी नहीं बता सकते. तो ये सब साथ में एक्यूमुलेट करते हैं और वो जो इंसान है उसको ऐसा ब्रूटल और इनह्यूमन एक्ट करने पे मे बी फोर्स कर देता होगा इन सब चीज़ों के लिए.
Yeah, that's right.
बिल्कुल.
What you say is absolutely, it makes sense in fact.
सर एक और हम इस पे डिस्कस करना चाहेंगे जो अभी रिसेंटली हमने एक बहुत ही दर्दनाक हादसा हमारे कंट्री में हुआ है कोलकाता में. एक हॉस्पिटल में एक डॉक्टर के साथ अभी जो हमारा रेप केस हुआ है. सर दैट वाज रियली ब्रूटल एंड इनह्यूमेन वी कैन से. सो इसके पीछे सर कैसे हॉस्पिटल्स में भी अगर सेफ्टी नहीं है गर्ल्स के लिए तो फिर तो हम कहाँ पे एक्सपेक्ट करेंगे सेफ्टी.
So you know what? I think we are making a mistake by linking it to two things. One, it's a doctor. Second, it's a hospital. And I have been talking about this wherever I have spoken that let's not see it this way. Let's see it a female. Let's not link it to a specific profession only. A female, it's a woman who went through this. It can be anybody. And at the same time, when it comes to security also, I think every place creates that type of a secure environment. But yet there will be some loopholes there, and it cannot be limited only to a hospital.
Exactly.
Correct.
It can be
Exactly.
any place.
For example, if you talk about the Nirbhaya case, I mean, the
Absolutely.
hospital was not involved.
That's what I'm
But
saying.
however, I mean, a female was raped. But the most important thing, see, one more thing, I mean, it's a new study that we have been doing it. So we're talking about the word brutality in rape. Right? Initially, even you would have observed, rapes used to happen. Right? But now I am talking about the brutality in the rapes. The brutality in the rapes is again somehow linked to the categories of the pawns. Because this is a study that we have done that initially, okay, the rapes were done, but there was no that level of brutality. I mean, inserting the rods or inserting the beer bottles in the vaginas of a female. I mean, I just wanted to understand, is it something a psychological disorder that
That is
brutality?
sadism. That is saddest part of those people. Maybe they are psychiatrically, psychiatric wise they are challenged. They're not mental well-being. Mental health is not absolutely right. They are unbalanced in their life. Such kind of people can go to any extent because while doing they do not know what they are doing. So it's a kind of like mental imbalance. I would say that they are not normal people. Any normal individual will not go up to that extent until unless he is not mentally healthy.
And yes, I can again agree with this on this that some ideation is definitely happening through these pawns as well about all type of objects and all that type of a thing. So I think that is definitely leading into some instigation about some doing some brutalism as well with the person who they are
Because
raping.
this is beyond
It can,
satisfaction. I
it
would
can be
say-
inspired, definitely.
Yeah, because this is beyond satisfaction, I would say. So that is what I believe. Here could be
I
one of the
agree with
reasons.
this.
Yeah,
I agree
one
with
of
this, yeah.
you're right.
Media
absolutely
also
right.
plays a vital part in it. Like episodes or shows we see like Crime Patrol or something. तो वहाँ पर देख के लोग सोचते हैं कि अच्छा वहाँ पे दिखाया है वो कर सकते हैं तो मैं भी
Let
कर
us
सकता
try.
हूँ.
हाँ.
Yeah.
हो
That's,
सकता है.
that's right. That's right.
बिल्कुल.
So, son, I really want to discuss with you about the NEET exam leak. I mean, the exam that just got leaked. I mean, this is not a personal comment on doctors But yes, that particular exam was leaked and it came into the media. I mean, it went through a trial in the court. But the major questions come now. Today we got to know that the exam got leaked. This is not the first time that
It
exam
has
for
happened in the
medical-
past also.
In the past as well. But this time when the exam got leaked, paper got leaked, we got to know. But there might be chances when the exam would have leaked, but we did not get to know about it. And in this entire system, in this medical system, those doctors would have been placed. Those were actually not deserving,
Not so efficient.
not so efficient. There have been cases of negligence. So, and it is a question, it is not my question personally, and we have seen it in movies as well. I can give you a reference of a movie by Kamal Hassan, Indian 2, in which it is clearly said that इसने 1.5 करोड़ रुपए में MBBS की डिग्री खरीदी. Does that thing happen?
See, if the comment you're talking about 1.5 करोड़ रुपए में डिग्री खरीदी, वो एक बिल्कुल अलग चीज़ है. It's not got anything to do with the paper getting leaked or whatever. No, even if we say it got leaked this time and the hype was created, everybody came to know about this. I'm sure you must be knowing about this specific line: a crime is not a crime unless it is not caught.
Yes.
So, is being committed for ages, whatever it may be, but only the time when it is caught, it becomes a crime.
Exactly.
So I would say the same thing. Maybe we are not sure about this. We may not be 100% sure about this. Is it the first time only, or it has been repeatedly happening in the past as well? We don't know about it. But this time for sure it was caught and it became a crime. Now, through NEET, a person will go to the medical college, whether the person has passed through the leaked paper or through proper way. Medical education is something which I think we can vouch upon as doctors.
Definitely.
It is not a joke to pass through. 5.5 years grill which you go through,
Exactly.
it's not a joke. वहाँ पे कोई सिफारिश काम नहीं करती, कोई paper leak काम नहीं करता, nothing works for you. And I know many people who have passed MBBS in 10 years.
Okay.
Well, we do this in 5.5 years, which is the normal time. But there are many people who have done this in 10 years, 11 years as well. Because it's very clear, I think our professors or people in the medical college are also very clear, they can't create a killer. They may be mediocre doctor, they may be some very good doctors, but they have to reach to a specific bare minimum level. It does not get through otherwise. So while entry may be through whichever the way, but the passing through cannot happen through that way. So even if there is a negligence that has ever happened on a patient, it is never purposefully done. It is never done in a way कि भाई आपको पता नहीं था. It's never the way in fact.
Sir, I think it is the way, in fact. The reason being, because the data that I am going to share with you is really an alarming data. 5.2 million cases of medical negligence have been reported in a particular year in India. And sir, what could be the possible reasons behind it? I think because when I see these numbers, then I think कुछ तो गड़बड़ है
So the
system
first
में.
point is, my first question is, what is medical negligence?
Medical negligence. Medicines were not given. Okay, to support this, I'll give you a case. It is a case of Kunal Saha versus AMRI, in which doctor had to pay 11 crore compensation because the treatment was not properly done. A person had a rash on the body. That person was not given the proper medication, and instead he was given the different advices which were not to be given. This case actually was litigated for 15 years, and eventually that medical group, I won't name that medical group, had to pay 11 crore as a compensation to that particular person. So sir, if we talk about this thing and medical negligence, can't it be related to the question that I asked, that there is something wrong in the system?
It cannot be. It cannot be, because if you see and if you go through this entire data of medical negligence cases, you may be surprised to know there may be some Padam Shri doctor also in that. There may be some biggest of the doctors also named in some type of
So
negligence
what
at some
name
point
he's
of time.
taking there, the biggest?
That's what I'm saying. So if you go through the micro understanding about all these things, it's not about somebody getting through the medical college with some or the other way, which is not the right means. It is all about that particular moment. I may know the entire thing about that particular way of treating that specific patient, but I missed it. for whatever the reasons. Maybe I was overworked, maybe I didn't have enough sleep, maybe I overlooked, whichever may be the reason, but that does not mean that I purposefully did this, or it is something which I always do for every single patient.
Or could it be the one, like only 46% of the healthcare providers are complying with the ethical guidelines? Could this be also the reason? This is also a data.
So data are what? The way you look at and you make a data, you can make data interpretation everything.
Okay.
So if you pull up the data on the Excel, you will have so many different outcomes.
Yeah.
Okay.
So what is
So-
ethical in your view?
I mean, ethical guidelines would be not taking a mobile phone inside the operation theatre. See, sir, these
We
are.
have seen the cases जहाँ पे after surgery
एक छोटी सी सवाल है मेरी आपने बोला ना जिस भी हॉस्पिटल का जो भी केस का आपने नाम दिया एक डेटा मैं आपसे पूछता हूँ हाउ मेनी लाइफ दैट पर्सन हैज सेव्ड टिल नाउ डू यू हैव द डेटा
No, I don't have that data.
Must be
actually.
many.
Go
That's
and
what I'm
collect
saying.
that.
That's what I was saying.
Must be
then
many.
you will understand that what data you are giving is negligible in front of the good work that person or that organization has done. There's so many millions of life not savable. I mean, such serious life they must have saved. So who remembers? Who talks about them?
So there could be another reason कि जो हमारे हॉस्पिटल्स हैं दे आर नो मोर हॉस्पिटल्स राइट नाउ दे आर लाइक मोर ऑफ अ कॉर्पोरेट हाउसेस और डॉक्टर्स को टारगेट्स देते हैं दे आर लाइक एम्प्लॉयज़ ऑफ द हॉस्पिटल्स तो टू अचीव दोज टारगेट्स डॉक्टर्स आर इन रश वो जल्दी जल्दी सर्जरीज करते हैं क्योंकि उनको पता है कि उनको एक दिन में इतना टारगेट करना है सो इसलिए नेग्लिजेंस हो रही है सर्जरीज में
I mean, these are just the
You know what?
society-based
Yeah.
questions.
This
मतलब-
statement which you just made,
Yeah.
I completely
Disagree.
deny this because
Okay.
this is not
Yeah,
the
yeah.
reality. Again, I would say this is a reality which is created by the media and I mean a lot of people which do not really know the real understanding of the thing.
ओके
I'll tell you, me being in corporate hospitals for so many years and being heading into the largest skill level, I can vouch for in my hospital, not a single patient is ever overcharged, not a single doctor is ever told to do something which is not ethical, not a single such thing can ever happen in any of such organization. I can vouch you for. See, all the big hospitals that you are referring about, let's say corporate hospitals, they all have got NABH, which is the highest level Indian accreditation in our country. And most of them also have got JCI, which is international level, highest level of accreditation in the world, in fact. They have very thorough means of checking every single system that you do.
All the process.
Every single thing you need to be 100% transparent about, right from billing to the clinical reasons, everything. Else they rip you apart.
Okay.
I'm telling you, this is a reality, and you must check the facts about this to the hospitals. The hospitals, which I can say, which really work on 100% ethics, are actually the corporate hospitals. I don't say about the other hospitals as well, but I'm telling you, but the perception has been created such that it's the other way around, which is not the reality. I can
एज अ
tell you.
लेमैन आई वाज सेइंग बिकॉज़
मैं आपसे वही कह रहा हूँ. Again, layman is something which, that's what I'm saying. It is created by the people.
Again,
We have
Again, the
also
media.
faced
Again,
we have
social
also
media,
faced-
Again,
social
the
media
social
impact.
Yeah.
Exactly.
No,
I
I'll
mean,
tell
the
you.
Bollywood, we see these things. See, these things come from a society, and society is made from all of us, right? You are specialized in a particular thing. This is just not to disrespect a particular sect of a society, but this is to bring into the society that whatever you see around is not 100% correct.
Absolutely
And we have a special panel who are actually explaining that these things are totally a myth.
Exactly.
Just a
So
social media thing.
I'll again come to the same point. Let's talk about the overall impression. Somehow, healthcare has always been very attractive to the people. Maybe after the Bollywood, this is the most attractive industry you can talk about.
आई वुड लाइक टू यहाँ पे मैं एक एग्जांपल देना चाहूंगी गब्बर इज बैक
हाँ, हाँ.
उसमें
I mean that-
एक वो ऑलरेडी ही वाज डेड वो उसको एडमिट कराते हैं तो वो हॉस्पिटल उनको एडमिट भी कर लेते हैं
वो
वेंटिलेटर
तो
पे
गब्बर
डालते
के
हैं
कैरेक्टर को बढ़िया दिखाने के लिए वो एक क्रिएटेड सीन है
बट मे बी
No
दिस
way,
इज हैपनिंग
no way.
डू यू थिंक द गब्बर इज बैक में गब्बर अकेले इतने लोगों को पीट सकता है दैट हीरो हूएवर ही वाज
ऑफ कोर्स नॉट
देन
So I'm coming to that
समझो
only.
मूवी है
You know what? The impression is created by many factors. One is how attractive the industry is. So, film industry, healthcare, and police. I think these three industries have been the most sought after industries for everybody. कि
Correct.
में कुछ भी करो, you become popular. And छोटी सी चीज़ में, and I don't say anybody is without any specific dot. Every industry has got some dot. Every world has got some dot. हेल्थ केयर में भी होते हैं कुछ ना कुछ ऐसे छोटे लेवल पे होते हैं, आई एम सेइंग बड़े लेवल पे बिल्कुल पॉसिबल नहीं है. कुछ कुछ होता है जैसे किडनी रैकेट हो गया, कभी कुछ हो गया, ऑल दीज आर रियलिटीज़, बट डजंट मीन दैट एवरीबडी इज़ लाइक दैट, बट इट makes people understand everything is happening in the same way. Now, how the impressions are created and how they mold the mind of a person. Delhi is said to be in the far off areas of our own country. Who have never been to Delhi, this is the most unsafe place for women.
100%.
People perceive
Yeah.
this. But the reality is, since we live in Delhi, it is, in my opinion, the most safe, rather the safest place for women. I have not seen so much police patrolling or police checks in the night anywhere in any other city than Delhi, and it's a reality. Now, what happens? Why does that perception come? Because Delhi is the country's capital.
Yeah.
नो कैपिटल में एक छोटा सा भी ऐसा कोई इंसिडेंस होता है,
वो
इट इज़
पूरे देश
ब्लोन
में
सो मच आउट ऑफ द प्रोपोर्शन. दिल्ली में वो रेप हो गया, दिल्ली में लड़की को ऐसे बोल दिया, बट सच थिंग्स आर हैपनिंग सो मच इन नुक्स एंड कॉर्नर्स ऑफ द एंटायर कंट्री
other parts,
विच आर नॉट blown apart like this. So the impression which is getting created about our capital is that this is a very very crime capital and this type of a thing, which is not the reality. We all live here. Same thing about the healthcare. If some incidents which is happening in some isolation with some specific person, it does not mean the entire healthcare is like this. It's a very wrong perception which is getting.
The only reason that we came up to this particular question were the numbers, and those are really the high numbers. And I'll give you that high number. There have been a sudden 110% case increase of medical negligence, and these cases were actually not reported earlier, but however, there have been a 400% increase in the medical legal cases. And that is how, when we saw these numbers, which were really high and the alarming numbers, it made us ask you that is it the reality?
So I would like to understand a denominator here. Why I say denominator?
Exactly.
We should always see these things against the overall picture. For example, in whichever we are, let's say 10 years back, if the medical negligence cases were this much only, what was the total number of cases treated in that particular year in the entire country, and what is that negligence as a ratio to that?
Yeah.
Is that 5%? Is that 15%? Has that percentage increased to the total or not? Which is not possible. So, for example, if you were treating, let's say, 1 lakh patients in maybe 15 years back, today we must be treating 100. I mean, maybe 100 lakh patients, more than much more than
Million,
that.
yeah.
In fact, maybe 10 lakhs, 20 lakhs, 50 lakhs. As a ratio to that, if this number has increased, we have to see this carefully. It's not possible.
And I would say it is so easy to defame someone and give the datas, but however, we really need to understand that doctors are really putting in their blood and sweat to get the treatment done.
Also, just to add to this, all these medical negligence cases has not been proven. It's only been alleged. This is medical negligence.
Okay.
I can allege you of anything. You can allege me of any XYZ thing.
No,
But it
this
has
is a
to be
very
proved,
important
no?
one. I think that's the beauty of our, I can say again, media, that if something happens today, it will be all over the newspaper.
Exactly.
But second day, third day, it will keep on shrinking, and by the time the final judgment comes, which is maybe in the favor of
That will not be
nowhere
supposed
it
to
will be
be.
published.
It is not-
that
that
in
will
our
not be
earlier
published.
podcast we discussed about the media trial. I mean, media itself creates a scenario that okay, we have punished a person and he is the accused person, and that person should be sent to jail. But
Yeah,
however,
simple.
there is a judiciary trial already going on.
yeah.
And when the actual judgment will come, no one will
Exactly.
publish.
Nobody will report it, or maybe a small news will be reported.
And in today's date, government and medical associations, they have put so much of regulations on ethical practices of medical
Me too.
practices, then regulations on billing, transparency, procedures, then second opinion, third opinion. We are educating our patients for their rights. That yes, you have your rights to take second opinion, you have rights to ask any questions what you want to ask.
Okay. So with this, I want to ask one more thing. Doctors are placed next to God, or I mean, sometimes they are, it's a
Considered
synonym.
as God.
It's a synonym that doctors are God. So does that actually create a pressure on you while doing the treatment? Because you are at such a level, because people expect, because if he is the God, देखो डायलॉग है ना, भगवान से तो गलतियां नहीं होती. तो it is in that way I'm asking, doctors are placed next to God. So does that create a pressure on you?
When we have a patient in front of us, we have no other pressure but to save the life.
Okay.
We don't even think about what people are thinking about us, believe me. And I'm saying this for entire doctor fraternity. And that's why I say that it's impossible that a doctor will purposefully kill a patient. It may be an offside because, adverse reactions happen to the vitamin tablet as well. You never know about this. Now it is up to you how you perceive this. You want to perceive this as a negligence or maybe as chalo theek hai, ho gaya, it's a normal thing, which is again a fact.
Correct.
It's totally up to you. But as doctors, when we have a patient in front of us, we only have one thing in our mind: treat the patient. We don't even look at any person's financial condition or the religion or whatever. It actually is not in our brains. It's not genetically into us. If some doctor is carrying that particular part, which may be in micro percentage, that is not a doctor then.
Doctors never think.
Absolutely.
We never
It is-
think
it
that
is not a
we are
doctor.
next to God or we
It
are
is not a
equal to
doctor.
God. It is the people, and why do they think? That is absolutely up to them.
Of course,
We-
because you are
we-
Because
life
it is your
savior.
work.
We
Because
like-
it is your
God
work
has given
that
us the
you
life,
know.
but
So-
our life savior are you.
Somehow, I mean, we believe that had
नहीं
we
नहीं वो
been
डेटा भी अब निकालना पड़ेगा आपको.
वो डेटा तो बहुत जरूरी है. All right. So now, one more thing, I believe it's like patients are no more patients. They are the customers. So believe it or not,
Commercialization तो हुआ है इस profession में.
initially when a patient used to come into the hospital, it was believed a patient has come in to whom we have to take care of, right? But now it is treated customer aaya. I mean, the words play a very crucial role. So, I mean, this is a question the people wants to ask, not me.
Yeah, it's
I mean, sir, I've been looking at me
नहीं
angrily.
नहीं मेरा एक क्वेश्चन इस पे है. I was waiting for sir to answer, then I will ask my question.
I mean,
We
sir
are
is
like
looking at me
speaking-
angrily.
No,
I'm
I'll
not
ask my
afraid.
question then.
Tell me one thing. What is your perception about what is a customer and what is a patient?
Okay. Patient would be the one who needs a treatment.
And that's it.
That's it. And customer would be the one who would say, he's the one who will be fetching out
Who will
money
be-
out of this particular
No, no,
Who
person.
will be
That is-
giving?
I mean,
who
that's-
wants a service and he'll be paying for the service.
I was coming to
yeah.
that.
Exactly.
That's the perception which we
Yes.
need to understand. The basic difference between these two terminologies is a patient is only looking at cure and nothing else. That's all, nothing else. But a customer, why a patient is called as a customer, and we see this day in, day out. A patient will not come to the hospital only for the sake of treatment. They will be finicky about the diet. इसमें नमक ज़्यादा है, यहाँ पे आपका AC कम चल रहा है, यहाँ पे आपके फर्श के ऊपर एक मक्खी पड़े हुआ है. मतलब they will talk about anything or everything on this earth.
Other than
Even if they are
disease.
getting the right treatment, they are getting completely cured. That is where this terminology came, that they are actually using every single service of the hospital. So it is okay to call them as customers. It has got nothing to do with the commercialization.
Okay.
They'll still be paying the same amount.
Okay.
But the reason why we call them as a customer, and I say it's actually reality. Many hospitals are doing this, not mine, but many are doing this. The reason why I see this is that it is for my internal teams to understand. Maybe my housekeeping team, maybe my F&B team, maybe my other non-medical team, which again are maybe air conditioning team, ki look at everybody as they are taking a service, just like the way hotel happens.
Exactly.
So there is nothing wrong in that. It's not. It has got nothing as financial as the angle to it. It's not for the people to believe that they are paying to you. That's why they're being called as customers.
And moreover, what I believe, it's like, just to run a hospital, there's an expenditure. I mean, when we get the money, only then we are in a position to get the better machines, the better equipments, the better, the medical, legal, or any other
No,
person who is
in a
more
very
related to
simple
it.
word, what sir said, it is just to increase the professionalism to the highest standards of
Yeah.
all the support services.
Okay.
So that everybody needs to be professional in their approach. So that the patient, when they come, they don't come alone. Na? If you go to a hospital with somebody,
Yeah.
your attendant, then your friends, then your relatives. So everybody comes and they see what? Patient will never ask for any service because he's a patient. He just wants treatment. So the
Yeah,
other people
relatives and
accompanying,
family.
they would grade, na, ki yaar, this was not there, that was not there.
Extra
Right,
bed and
Yeah,
everything.
yeah. So if you go to the
It's-
government hospitals,
Yeah,
they are real patients.
they are real patients.
They will not complain about the washroom. उनको बस जगह मिल जाए, that's good enough for them. They will not complain about the bed. उनको बेड के नीचे लेटने की जगह मिल जाए, that's good enough for them.
वो उम्मीद जिस उम्मीद से आते हैं
Of course, अगर-
उनको उसी उम्मीद की सर्विसेज मिलती हैं
Yeah.
तो कहते हैं कि हाँ यही सोच के आया था मेरे को यही मिल गया
Only concerned with one thing, which is treatment and the clinical part. But a patient which comes to the, I mean, private hospitals or the corporate hospitals, they are looking at every single thing nowadays.
Yes.
So they are actually complaining about every single service also, and they're enjoying also every single service. So, for example, in my hospital, ever since the summer this time was very, very hectic, I made it a mandate every single patient coming to the hospital OPD, which is about 1,000 people coming every single day, they will be given water bottle free. Not a single penny to be, which I'm doing even till date. We have not stopped that. But again, this is a service which you are giving to our customers because they are coming to the hospital. They require cooling to be given to them.
Yeah.
Everything is there. But beyond that, also what we can do, I want to do that. But it is again for the same reason that we are looking at them as somebody who's using all services of the hospital.
Okay. And now that there have been a lot of serious topics, and I think the society would get to know the reality of this profession. Now let's, we are on the concluding part of the show, and let's, there is always a happy ending to the show. So let's ask some happy ending questions, some fun questions, जो एक आम जनता जिनके बारे में बहुत छोटे छोटे से और
So
मजेदार
it's just a
सवाल
fun segment.
Yeah, please.
We call it myth or fit.
Hmm.
So we'll just say a sentence and you have to say कि ये myth है society में या it actually fits in the society. So first one is protein powders are disease house.
It's
Is
a
it a
disease
myth?
house.
Is it myth or is it really a fit in the society that protein powders are disease
So
house?
again, you cannot answer in one sentence like myth or
Yeah.
fit because
Okay.
there are two parts to protein. One is the natural protein which you get from the milk.
Okay.
No, we're talking
नहीं,
about
we're talking about the
artificial
protein
proteins.
powders.
Artificial
we
is
get the wheat.
is a not a fit rather.
Okay.
It
So
is-
again on that also,
Yeah.
again it cannot be just one word. Is
yeah,
it's a myth or a fact.
fortified है नहीं है क्या बहुत सी
What
चीजें
type
देखनी
of
पड़ती
protein
हैं।
powder are you using? As Dr. Sanjay is saying, is fortified? Is it not? And not? What contents are there? How it is built
It's
up?
whey protein or protein based or
Yeah.
plant based. There's so
Absolutely.
many things to it.
And how it is being used. If
Yeah.
it is in moderation, absolutely fine. I mean, this is the most, I can say, the best thing a person can have. But at the same time, if it is not in moderation, is bad. Anything
Bad.
in excess is definitely bad.
So concludingly, can we say that protein powders, well certified in a well quantity, is a good fit?
You know, if you're having a proper nutrition, proper diet, proper meats, proper eggs, proper fish, you don't need any
You don't
protein
need that.
supplement.
Oh wow!
But you still want to have additional into this, that's okay. At the same time, you need to burn it also. You have to have appropriate physical activities happening, else it becomes accumulation in you only. Long run, mein, it may not be good
Bilkul
if this is
simple,
not in
sir.
moderation.
What we need is a 1 gram of per kilogram of body weight protein.
Yeah, yeah.
How you get that? You eat one egg, that gives you 6 grams of protein. You eat 100 grams of chicken, that gives you 10 grams of protein. You eat 300 grams of meat, you will get 100 grams of protein. So there are various sources from where you get natural proteins, which your gut will absorb. So protein should be biodigestible and bioavailable.
Okay.
If that is both the things, it is good.
Yeah.
Right. Next.
Next would be 2 pegs a day keeps the problems away.
Who says that?
I mean, I have seen a lot of people, majorly the senior citizen people or people above the age
You
of
know, this line was
55
actually
is like-
this line was
like
actually created by a wine company.
Acha. Well, doctors do not recommend it. I mean, it is usually said. I mean, even if I would say if people in my family, I wouldn't go to the society at a large. Just to see in my family, people would be like, yeah.
थोड़ा
alcohol-
बहुत
दो
सही
पैक तो
है.
बनते हैं. I mean, 2 पैक से कुछ नहीं होता.
Alcohol
It's
in
like-
any amount is not good for your health.
Okay.
Alcohol as such, what does it do? When it takes it, it gets converted into acetaldehyde and it deprives you of oxygen.
Okay.
Acetaldehyde is what? It's like a poison. It reduces the pH of your body, which is like 1/10 of a difference in normal and acidic. And when your blood becomes acidic, that is when you don't start feeling well. It poisons your brains
Okay.
and all those things. But if you have to drink,
Yeah.
In case.
So on a
Let me be on.
on a
या
jovial
इन केस क्योंकि अब जिन्होंने पीनी है वो पिएंगे so what is
But
the best
doctor's
Tequila-
recommendation क्या रहेगा?
Tequila is the best one. Then clear alcohols like vodka, gin, but without sugar. Just on some cubes of ice and water. That's
तो इसको मैं थोड़ा सा और I'll add some more fun to it. I'm sure you might have heard about this joke. There was a person who was called to a workers factory कि बड़े वो दारू पीते थे डेली शाम को. He was called to train them कि भाई alcohol is not good for you. So what he does, he gets 2 drums, big drums. One was filled with alcohol, other was a normal water. And then he got earth forms, केंचुए जो होते हैं.
Yeah.
उसने सबको बुलाया. I'm sure you might have heard about this. उसने दोनों में केंचुए डाल दिए.
दोनों में डाल दिया.
अल्कोहल भी जिसमें केंचुए थे वो सारे ऑफ कोर्स दे डाइड.
Yeah.
पानी में वो तैर रहे थे. He asked the people who were in the surrounding, क्या देखा तुमने? अल्कोहल पेट के लिए अच्छा है, कीड़ों को मार देता है. So you know what, the things depend a lot how you want to take it.
yeah.
Instead of listening to the entire thing, if you want to grab from the middle and say कि this is good for me, let the other part go to hell. ये होता है ऐसा.
ये होता है.
And this is the reality. Is the 2 packs thing is also the same.
टू पैक में भी डिपेंड करता है उसके साथ खा क्या रहे
खा
हैं.
क्या रहे हैं.
कार्ब्स खा रहे हैं. फिर हाई यू शुड हैव हाई
अच्छा,
ओमेगा
सर,
3.
मतलब क्या खाना क्या चाहिए उसको?
High omega 3 contents like fish
Okay.
Okay.
you should eat.
And for the
Then
vegetarians?
fish also not
Peanuts
that
हो जाएगा.
the farm fishes जिसको breed किया जाता है because they are surrounding in the same pond and you know they excretas and they are ingesting each other feces and they become toxic. Not those. Fresh water, fresh river farms, seafood, they are good.
And
High
for
in
the
fat.
vegetarians?
Paneer, dairy products.
These are good.
Yeah.
That accompany alcohol well.
Yeah.
Wow.
Next would be intermittent fasting is the best way to reduce weight. It's a new thing in the market, intermittent
I mean,
fasting.
people are crazy about this intermittent fasting कि यार अब खाएंगे ही नहीं 12-12 घंटे नहीं खाएंगे.
That's not correct actually. The ideal part is that you must rather eat frequently, but small portions.
So
So it's a myth.
It's
So
a
it's a
myth.
It's a myth.
It's a myth.
So nothing one fits to everybody.
Okay.
Yeah.
Everybody has a different body
Yeah,
physiology,
absolutely right.
and maybe you are vegetarian, she is vegan, I am carnivore, sir can be vegetarian, whatever. Every body physical needs is different. It is you who have to understand over a period of your time that what is suiting me best, what is keeping me healthy, what is not causing me brain fogging.
So next would be glutathione injections helps in skin whitening. Is it a myth or really a fit?
It's a myth.
It's a myth? Okay.
Yeah. Glutathione can be naturally, it's present in the natural things because if you buy glutathione injections, they're very, very costly. But if you take proper diet where it can naturally get into your body from, you know, red meats, it has a lot of glutathione content, you will get directly into your body. Why do you want to take injections and all?
But
Because
it's a
see,
huge business अभी
business तो
cosmetic
create किया जाता है ना.
surgeons का
I
It's
mean,
all
in the
created.
Bollywood we see
Yeah.
that, you know, all of a sudden.
It's all created. Business तो
It's a hype
मतलब
thing.
hype thing है.
All right.
walking barefoot on grass improves eyesight.
See, the two things to it. So why I don't think eyesight is improved. That's a myth. But walking barefoot on the ground helps you touch the ground in your barefoot. So what happens? You see the earth is total magnetic, na? Center of the magnet. When you touch your feet with the ground, the entire 32 trillion cells in your body changes their polarity.
Oh wow.
So it's good in other way, but not improving eyesight.
I mean, that is how we can say that Google is something that gives the entire wrong information almost.
No, Google doesn't give wrong information. Google gives you information.
Information.
How you
Right.
interpret, how you interpret that information is your problem.
ये ग्रास वाली बात गूगल का कसूर नहीं है, तो हम बहुत पहले से सुन रहे हैं.
सुन रहे हैं.
Exactly, because see, last night when we were, you know, discussing about this question, and we, you know, Googled out the entire thing. We did a lot of research, ki how it is happening. Not even a single website have given us a result that says that okay, walking on the ground barefoot on the grass is a myth.
Everyone was saying yes, yes, it
It's a
helps
myth.
in improving eyesight. इवन ऐसे भी होते थे बचपन में, जैसे किसी को स्पेक्स लग जाते थे तो उसको एक रिकमेंडेशन दी जाती थी कि आप सुबह जाओ अर्ली मॉर्निंग पार्क में ग्राउंड पे वॉक करो, आपका स्पेक्स उतर जाएगा.
कितनों का उत्तरा किसी का.
किसी का नहीं था.
तो इसी में ले लेते हैं वो क्वेश्चन भी हमारा कि अननेसेसरी टेस्ट आर रिकमेंडेड इन हॉस्पिटल्स patients?
See, it's not. I would say this is an incorrect way to look at this. I'll tell you about the history where it is originating from. I'm sure with your background about legal, you know what is CPA, Consumers Protection Act.
Consumer
Ever
Protection.
since the medical profession got added to this. Now again, if you see historically your cases, initially the people were not getting too many tests done. But the doctors were getting caught कि आपने अगर ये दवाई दिया तो आपने इसके लिए टेस्ट क्या किया? What is the evidence to recommend this medication only?
Okay.
We were taught, I mean even in our generation also, but हमारे पहले तो और ज़्यादा था, but we were also taught कि आपके लिए pulse is a very important parameter. This will give you up to 90 to 95% accurate diagnosis, which actually is the reality. But उसका कोई evidence नहीं है आपके पास to defend yourself in the court if something goes wrong. Not to save yourself, when you came into CPA, doctors were having no option but to have tests done on the patients before prescribing any medication, before thinking that this is the case where the patient requires this surgery or whatever. They have to get the test done. And the test, of course, increased then. And why it is more looked at into private hospitals, they are getting too many tests done because they are the one who are covered in CPA. It's not the government hospitals. It's all about that actually. If you take off the CPA today, this will come down by 90%. If you tell doctors you are not covered in CPA anymore, I'm telling you, it will come down by 90%.
Okay.
It's purely about creating an evidence to safeguard yourself. If something goes wrong ever, what evidence do you have to tell in the court of law, I got this medication done on a patient, or I got this surgery done on a patient because this was the evidence for this. You don't have anything. Court will not listen to you कि मैंने pulse में देखा. They will not listen
But
to you.
sir, then I would say कि ऐसा भी होता है, the patients have already done the test, but दोबारा से उनको यही रिकमेंड करते हैं सेम टेस्ट कि आपने कल कराया था, बट आज आप दोबारा से यहाँ पर कराएं इस
ये
हॉस्पिटल
तो आप कल की बात कर रहे हो. There are some tests which actually change every second hour also.
Okay.
Now again, it's a matter of understanding and explanation. But yes, I hold this to myself as a doctor as well. कि I have to explain this to the patient. Why
Patient,
am I
yeah.
asking for it?
Okay.
For example, there was a very recent complaint that came to in one of the hospitals that a patient said that I came to the hospital, I had an ultrasound done 2 days back, same thing. But मैंने डॉक्टर को आके दिखाया, उसने बोला नहीं आप अभी दोबारा अल्ट्रासाउंड कराओ. तो मेरे पास कोई ऑप्शन नहीं था क्योंकि मैं उसी अस्पताल में था, मैंने वहीं से अल्ट्रासाउंड कराया. इन्होंने अपनी कमाई के लिए दोबारा अल्ट्रासाउंड कराया.
Exactly.
But if you see the clinical picture of that particular case, it is an intestinal obstruction which changes its picture every half an hour. Forget about 2 days back. So for a patient to be operated or not to be operated, doctor had to take that call.
वो एक परसेप्शन ऑलरेडी जो बना है सोसाइटी में.
Absolutely. So this again is something which is, and yes, of course, at times what happens, again, it's a matter of explanation. Labs or radiology services are opened at nook and corner also. If you go through the labs, there will be some labs which are functioning in a specific corner of the गली के corner में काम कर रही होंगी. They have got no accreditation, they have got no standards. वहाँ से अगर कोई patient test करा के लेके आएगा, if I am going to be giving the treatment based on that report, I cannot do that. I will want it to be a proper lab which is giving me the
NABL
report.
accredited,
Yeah. So in that case, if I say कि आप मेरी lab से कराओ, it has to be taken that way. It's not for any earning for it. Doctors don't get any benefit out of this in any case.
Okay.
Neither the hospitals track कि मैंने कितने test कराए.
Because we were under an impression that the target thing that we actually discussed.
No, that's
we
what
were
I'm
under
saying.
that impression that okay, you need to get this thing done.
Again, this is a perception which is created out of I don't know what type of a mindset, but that's not the reality.
And you said, Navarun, the people should spend on their health also.
Exactly.
So even if that report comes as normal, that makes your baseline that today everything was normal. Be happy in that, no?
Exactly.
That's a big thing which you just said.
We can connect
मतलब
that.
हम लोग
वो ना हमारे इंडिया में कि अगर
एक baseline
रिपोर्ट्स की
बनता है ना.
अच्छी रिपोर्ट्स आ गए तो ऐसा लगता है ओहो पैसे वेस्ट हो गए
पैसे
यार,
waste हो
क्यों
गए.
ही टेस्ट कराया, अच्छी
बिल्कुल.
रिपोर्ट्स तो अच्छी आ
मतलब
गई.
आज तुम ठीक हो ना, ये सब चीज तो पता चली है ना. कल को तुम बता नहीं सकते हो ना कि बीमारी तुमको कल से पहले थी या परसों से पहले थी.
Exactly.
अगर आज रिपोर्ट ठीक है तो भाई
We have that
परसों तक
line.
तो नहीं थी ना, जो भी है कल से ही हुआ है.
कल से ही हुआ.
तो ऐसा क्या किया 2 दिन में पता चल जाएगा.
मैं अपने गेस्ट का तहे दिल से शुक्रगुजार हूं कि उन्होंने जितने भी जवाब दिए खुले दिल से और साफ मन से दिए. मैं इस शो को ऐसे कह के कंक्लूड कर सकता हूं कि आज के समय पर रेगुलर हेल्थ चेकअप की कितनी इंपॉर्टेंस है. एक हष्ट-पुष्ट शरीर भी अंदर से बीमारियों का एक घर हो सकता है. एक इंसान देखने में जितना हेल्दी लगता है, ये उतनी ही पॉसिबिलिटी है कि वो इंसान अंदर से उतना ही अनहेल्दी हो। इसके लिए आई वुड रियली सजेस्ट टू गो फॉर अ रेगुलर हेल्थ चेकअप।
एंड ऑल्सो हमारी ये अपील रहेगी हमारी कम्युनिटी, हमारी गवर्नमेंट, स्कूल्स एंड यूनिवर्सिटीज से, जो भी टॉपिक आज हमने डिस्कस किए हैं हमारे शो पे, सेक्स एजुकेशन, मेंटल हेल्थ, कार्डियक अरेस्ट, हार्ट डिजीजेस, इनके ऊपर और अवेयरनेस प्रोग्राम्स लेकर आए। ये अवेयरनेस प्रोग्राम्स सिर्फ पेपर्स में नहीं, ग्राउंड रियलिटी में होने चाहिए।
तो मैं अब इस टॉपिक को और इस शो को ये कहकर कंक्लूड करूंगा कि सुसाइड इज नॉट अ सॉल्यूशन। अगर आपको लगता है कि सुसाइड एक सिर्फ और सिर्फ एक लास्ट रिजॉर्ट है, यहां पे हम अपनी लाइफ से हार नहीं मान सकते, क्योंकि हर चीज के बहुत सारे सॉल्यूशंस होते हैं और सॉल्यूशंस हमारे आसपास ही होते हैं। वी नीड टू फाइट लाइक अ वॉरियर, वी आर अ वॉरियर विद इन। हम अपनी लाइफ से हार के भगवान की दी गई इतनी प्यारी नियामत को खत्म नहीं कर सकते। और मैं आज सब पेरेंट्स के साथ ये बात डिस्कस करना चाहता हूं कि प्लीज 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 अपने बच्चे को इतना प्रेशर मत दीजिए कि वो लास्ट में अपनी लाइफ से हाथ धो बैठे। विद दिस साइनिंग ऑफ, योर होस्ट विद माय को-होस्ट द शो। थैंक यू सो मच।
वी होप आपको हमारा शो अच्छा लगा हो। अगर आपको अच्छा लगा है तो लाइक कीजिए, सब्सक्राइब कीजिए एंड शेयर कीजिए अपने फैमिली एंड फ्रेंड्स के साथ। स्प्रेड द वर्ड्स। थैंक यू।